Hi, I'm Dr. Hagmeyer with the Naperville Institute for Neurometabolic Solutions, and I've received a couple emails over the last couple of weeks really asking me the same question. And so I couldn't help wonder how many more people are out there really wondering the same exact thing. And so this is why I decided to shoot this video. Today's video is called 10 Things Your Doctor Should Be Doing for Your Chronic Health Condition. The second part of this video, I'm going to explain to you how to choose a holistic doctor when it comes to wanting to get to the root causes of your chronic health problem. Okay? I'm going to ask you a couple questions and or pose a couple questions out there, and if you answer no to any of the following questions, then it's most likely that your doctor is actually acting as a roadblock or a hindrance to you reclaiming your health and living a life that you really deserve. Okay? By no means am I saying that you have a doctor who doesn't care about you. I'm not saying that your doctor is not smart. It's more of a situation of how your doctor was trained and the kinds of tools that he uses to help people get better. Okay? So the first thing is this. Does your doctor spend enough time with you to answer all of your questions and concerns? Okay? Too many doctors today are in and out of the room. They spend 5 minutes with a patient, and then essentially they tell the patient to come back in 6 months for some updated blood work. Hint, if you spend more time in the doctor's reception area waiting for him or her to see you than the actual time spent with your doctor, that's a problem. Okay, number two, has your doctor provided you with a written treatment plan with clear goals, objectives, and really benchmarks that can really be measured? Okay? Or is your doctor just basically upping and downing your medication based on maybe, say, for example, your TSH levels? Okay? Number three, has your doctor given you a specific and customized dietary guidelines to follow? This is so important because too often, if you want to get well, the reasons why you got sick were because most likely of your diet. And unfortunately, too many doctors today don't really have a good grounding in what that really means. Too many will tell you, go home, eat less red meat, and get more servings of grain. You need 8 to 10 servings of grains. Okay, that's pretty much the general advice. And then, of course, they'll throw in, make sure you exercise. Okay, that's pretty typical advice. That really doesn't cut it for the vast majority of people. They need real specifics. Okay. Number four, has your doctor given you a specific exercise program that is really going to ensure that you are burning fat instead of sugar? Too many people today are not burning fat, they're sugar burners, and so they're not getting to the areas of the body in order to burn fat, get their metabolism going. Okay. Number five, has your doctor ever specifically checked your nutrient deficiency status? Okay, we're talking above and beyond just looking at things like vitamin D and vitamin B. Has he really checked your nutrient biochemistry? Each and every one of us has a different foot map of basically the essential nutrients that we're deficient in. And there's some very specialized testing that's now available that people can get that will shed a whole lot of light on what specific deficiencies an individual may have. Okay? And that's a specific test that we actually do in our office with virtually every person that comes in. Number six, has your doctor ever ordered a salivary adrenal stress index for you? Okay? This test really is going to look at the relationship that exists between cortisol and the adrenal glands, okay, in times of chronic stress. So in times of chronic, persistent stress, your body's going to release a lot of cortisol. And as your body makes this cortisol has the ability to block the performance of your thyroid gland, okay? So you really should have your cortisol levels evaluated, okay? And they're best to be evaluated through saliva as opposed to blood, okay? Number seven, has your doctor looked at the possibility of things like mold and parasites and gut dysbiosis or gut infections? Okay, very, very important. This is a test we use in our office that really looks and evaluates the health of the gastrointestinal system. Okay, this test, in fact, just this last week, I ran a test on a patient who has an autoimmune thyroid disorder, and she really had over 4 different kinds of parasites and pretty nasty stuff. Living in her belly, and it was really just tying up her immune system from really doing the job that our immune systems are designed to carry out. Okay, but the only way you're going to get better is if you make changes to your diet. Okay, so it's nice to know what foods you can have and which foods you can't have if you want to get well. Okay, has your doctor run a food sensitivity test to things like egg and soy and milk and yeast and gluten and what are called cross-reactive foods? What I find over and over again is that too many people are eating the wrong kinds of foods, and if we don't identify these foods, you're going to just keep on eating them, and you're going to get worse, and you're going to get sicker. The next thing is has your doctor really looked at your stool to again check for things like parasites and worms and lots of other different kinds of hidden infections that could be the source of why your blood sugar is up and down and what we call dysglycemic, okay? Number 8 is, has your doctor ordered a complete thyroid panel for you? Okay, many doctors today really just order a TSH and a T4. Nevertheless, there's over 10 different thyroid markers that really should be evaluated for individuals who have abnormal TSH levels, okay? Number 9 is, if you're a man, have you been evaluated for andropause? Okay, now this is a condition for men where you have too much of a female hormone related to testosterone. Okay, your testosterone levels could be completely normal. In fact, most of the men that I work with that have andropause and are suffering with andropause actually have pretty normal testosterone levels on blood work in terms of when they bring that blood work into us. However, they have more estrogen levels that are elevated, and that's a major, major problem. Too much estrogen in a man is responsible for things like prostate cancer. Okay, so that's something you have to be very aware of. Number 10 is, if you're a female, has your doctor ever ordered an expanded female hormone panel on you? Okay, if you are a female and you're postmenopausal, has your doctor ever assessed your risk factors for developing uterine or breast cancer? So if you answered no, I know I shot a lot of things out here to you in this video. I wanted to make this quick, but if you answered no to any of these, or the vast majority of these, then there's a good chance that your chronic health problem is really not being managed as comprehensively as it should. And I want you to realize that. You deserve better, okay? I hope this information helps. I hope this helps you choose the best doctor when it comes to your chronic health problem. And for more information, please check out our website. There's just a ton of information on our website at www.drhagmeyer.com. That's drhagmeyer.com. Okay? Take care.